Hi class, this is my video response for week 8, discussion 1, advocating for patient care, specifically for the patient experiencing some preterm labor symptoms, and this is my response to the collaborating physician. So I do disagree with your orders, along with the patient to be discharged home on bed rest, as there is no evidence that bed rest during pregnancy, whether at home or in the hospital, is effective at treating preterm labor or even preventing that preterm delivery from happening. I would also like to see the patient before they are sent home to complete some more tests and for further evaluation from myself as well. I know that you've completed a manual vaginal exam with her cervix long and closed as you stated. However, I would like to put the patient on the monitor and obtain an NST. I would like to complete this to view her contraction pattern along with baby's heart rate in response to the contractions that she is claiming to have. The NST may show us that the patient is having a true contraction pattern regardless of her closed cervix. If the patient is experiencing painful contractions, the use of a tocolytic such as terbutaline might be helpful for this patient. Since the patient also has a history of 2 preterm births, the administration of steroids for fetal lung maturity is also important and should be educated for this patient. Babies who are born very early may have trouble breathing because their lungs are not fully developed yet. For this reason, it's important to give mother the steroid medication before birth. These steroids will help the child's lungs develop more quickly. These injections will be given in 24 hours apart. So I would like to start tonight with the first injection and then provide patient education that she'll need to come back same time tomorrow to receive her second injection. In regards to preterm labor specifically, a fetal fibronectin test would have been helpful. This test can determine the patient's likelihood to have a preterm delivery within the next 2 weeks by measuring the chemical biomarker fetal fibronectin. A positive marker is highly predictive of the patient experiencing a preterm birth within the next 1 to 2 weeks. However, this test needs to be completed before a vaginal exam, any ultrasound, anything internal, which in this case we cannot provide for the patient since the exam has already been completed. With the FFN, talking to patients experiencing preterm symptoms in general, complete patient history should be completed, especially when, like I mentioned, completing the FFN test, if that was completed or if we had the chance to do that. High priority questions should include, had this patient had any recent sex? Is the patient bleeding? This is specific towards the FFN, since recent sex or bleeding can cause miscalculations or false positives for the FFN. Leaking any fluid, the patient should be educated on preterm labor symptoms, when to call back. So like I mentioned, any bleeding, leaking any fluid, contraction patterns. If the contractions keep coming, don't stop. She of course came in tonight, but I would really like to, like I mentioned, complete these other tests, especially the NST, to really view her contraction pattern and view baby's response to what is happening as well. The steroids I think would be great considering this patient has already had 2 previous preterm births. I think this would be great to get these steroids on board for the patient. I'd like to go through all this, really talk to her, evaluate the NST strip, reevaluate, and then send the patient home for discharge, but I don't believe there's any reasoning for bed rest. Just truly provide patient education as far as what preterm labor symptoms are, when to contact us back, when to come into the hospital, along those lines. Thank you.